Welcome. Thank you so much for coming to our conversations with CareMount. My name is Dr. Amy Magneson. I'm an OBGYN with the Mount Kisco group, and I also see patients up in Carmel. Today, we're going to talk about a topic that is somewhat becoming dear to my heart. I see a lot of pediatric gynecology patients as well as teenagers, and so I really felt like this was a very pertinent topic to bring to the forefront and talk to parents about. So my topic is sexuality and our children, perspectives from a gynecologist. And this is appropriate for both boys and girls, parents of boys and girls, preteen, toddler, any age. So this is just some statistics about our teenagers. These are recent. This is as of 2015. So on average, first age of sexual intercourse, which is the term coitarchy, is the fancy name for that, is 17 years old. And 13% of girls and 18% of boys are sexually active before the age of 15, which is slightly frightening. And 44% of girls and 49% of boys, which is almost 50% of children, are sexually active between the ages of 15 and 19. And this has remained pretty stable since about 2002. The use of contraceptives in these age groups is steadily going up, which is a fabulous thing. And adolescents, this is also the unfortunate thing, adolescents account for 50% of the 9.7 billion people who get STIs, sexually transmitted illnesses, a year. And that was a statistic from 2008. And I don't have a more up-to-date one, but it's probably pretty similar. So, embarrassing questions. How many people had their parents discuss sex before college, high school, or junior high? Hands? Mine did not. All right. There was no hands raised. How many people had health in school? I didn't. I did in like high school. How many people have talked to their children about sex or sexual things? I see a lot of nodding, so that's good. I'm happy about that. And then how many people are embarrassed to bring up sex with their kids? All right. This is it. Here we go. Good audience here. Okay, goals for today. So we're going to talk about sexuality at all ages, tools for reaching our children, teenagers and gynecology, so communication, specifically the teenage gynecologic visit, which is more towards girls, and then STDs and pregnancy prevention, as well as any questions you may have. Okay, so where do your children get their sexual education? Nowadays, most of your children are getting their sexual education from social media, television, movies, video games. Friends are a huge aspect of that, and health in school is lower on the list, but that's where a lot of children hear about it. And what should be the number one source? And I believe the number one source should be parents and caregivers. So those family members and friends that are around, that are older, that are mentors, that are really reaching out to children and encouraging them that this is something they need to learn and pay attention to. So sexual goals. Wait, what did you say? You have sexual goals for your children. All right, so a lot of teens do not know that it's not okay to have sex. So a lot of children, teenagers, think that they have to have sex, that they see this on TV, they see this on social media, their friends are doing it, and they think they have to be doing this. And I see this every day. I see young girls who come in who really don't know why they want to be having sex. They're just doing it because that's what they think they're supposed to do. And our society tells us that. I mean, just look at the change in television programs from when I was a teenager. They really they had sexual innuendo, but it was not blatant intercourse, sex happening all the time. And now it's everywhere in our movies and TV, YouTube, the way we dress, everything. So these are some goals that I think you should have. So communication with your children is incredibly important, and you want this to be early on. You want to be the leader even of your teenagers. Your teenagers need someone who's telling them how to live, how to survive, because they are just in this sea of lots of information from all these different sources, and they really need guidance. So they want you to be the leader. And set limits, especially with social media, with dating, with curfews, what you feel is appropriate and what you would like. So make goals for your kids. Get involved with your children's boyfriends, girlfriends, friends. Have them over to their house, your house. Get to know them. Advocate for your children. So if you see things happening at school, they have questions, they're worried about things, get involved, get to know what's going on in the health class, what they're teaching, go to back to school night and really advocate for your kids. Before you get angry at your children for making some of these decisions, listen to them because they might have a different story to tell you that you just don't know. And listen. That is the biggest thing. Just listen to your kids because they are going to tell you things that you won't expect and you'll be surprised about. So listen, your children want to talk about sexual matters. They want to talk about it when they're little because it's curiosity. They're just asking. And if you're embarrassed about it, they will be embarrassed about it. If you seem angry that they're asking you these questions and you seem like you just, they did something wrong by asking you, then next time they will probably not ask you that question. So you want to encourage them if you're afraid to talk to them or if you see that they're nervous to talk to you, tell them to talk to like grandparents or their aunts and uncles who they might feel comfortable with. Tell them to talk to their pediatrician, their gynecologist. You can take them and say, I'm going to leave the room. You talk to your pediatrician. That's a really important bonding time between doctors and teenagers and even younger or other trusted mentors. And then you want to keep the communication open because they'll keep coming back to you with other things if you are willing to listen and keep that open. So sexuality at all ages. So we are sexual beings. From the moment we're born, we have vaginas and we have penises, and they're there. And we want to know what they're for. It's just like any other body part. So when we're toddlers, we start asking our parents questions. Why do I have something different than my brother or my sister? And what I want to encourage is in this age group, answer their questions and do it in an anatomical way. Use terms that they'll learn and that are proper. So use the term vagina, use the term penis. Make those terms not embarrassing. Make them not funny. Just make them anatomy. And then they'll start to talk in a different way about it. I mean, of course, there's going to be jokes about these things, but that's okay. And you can sort of guide them in that. But encourage those questions and show them pictures if they have questions. If they don't have a brother, show them a picture or, let them ask of their dad. Or if they don't have a dad or another male, person living in their household, then show them pictures of male anatomy and explain to them why they're different than explain anatomy. Is basically that. And in elementary school age, again, they're going to start asking questions. Maybe you have brothers and sisters, or they have, they see a pregnant woman and they're going to start to ask these questions about how did that baby get in there? And instead of shutting down the conversation and saying, oh, the stork brought the baby, tell them a very age-appropriate answer. And you can do that. Like you can go on Google and find really beautiful pictures, and we'll get to it, but I brought some books to show options. And then preteen, of course, you're getting into puberty and you want to reach out to them and talk to them and show them that you are there for them so that when they need their first bra or they have hair somewhere where they don't understand why it's there, they can come to you and ask you and feel comfortable. And then when they're teenagers, they'll talk to you about stuff. Okay, so talking about sex in your body. So let your children ask questions, like I said. Use appropriate terms, and I cannot stress this enough. Use anatomical terms. It's really easy to just call things a hoo-ha or a vajayjay or whatever, but if you use the anatomical terms, you're really going to just cut out that embarrassment, and you just say, this is what it is. Your stomach is a stomach. Your intestines are intestines. Your penis is a penis. Your vagina is a vagina. The testicles are testicles, and that's okay. And you want to give them as much information as they need for that age group. So they will give you cues for that. So clearly you don't want your 5-year-old understanding every single thing about how to have sex and where the penis goes and the vagina happen, all of that. But you can give them a very good answer without giving away too much information. And it's okay to say, you know what, I think you're too young. I'll explain this to you later. And then use resources at your disposal. So a picture's worth 1,000 words. So you can find age-appropriate images. I brought 2 books that I like this company. It's Usborne Books, and they have these great books. And I am big on anatomy books. I mean, this is a very young version of an anatomy book, and it's the human body. And my kids love this. They ask questions. Mom, what's in blood? Mom, what does my brain look like? And I can take it and show them. Here's a brain. And you can show them the anatomy, and you can show them, and you can find all of these online. Like, you don't have to spend money on a book. You can find these things on Google Images and find really good cartoons. And I wanted to show you, this has a great section on growing up, and it talks about contraception or conception. So like body changes, there's this whole section on body changes, and it has these beautiful pictures, where they show sperm and an egg and this is real. This is a microscopic picture. It's a electron microscope. So you can discuss these things, and like, this is where the baby is, and you can show them, well, where does the baby grow? Okay, here's the uterus. The baby grows in the uterus, and there's some beautiful online. You can find beautiful cartoon pictures. And I say cartoon because they're, like colored pictures of anatomy with a baby inside of a uterus, and show them where the baby lives. And then they're going to say, well, how does the baby get out? And then you can bring up the vaginal delivery or C-section. You can show them that, and it doesn't have to be creepy and gross. I would say YouTube has some scary videos. So best to pre-look at those. But then, it gets into hormones and what's a hormone and what's puberty. So like, there's really great resources like this. And there's even books that are for younger kids. Like, this is a flip up book, and this is just about specific questions, but they have a similar one for the body that's similar to this, which has anatomy, and it's a flip up book. So like, it'll show you, look at how tall you are, or like, it has the pregnant woman, and you pop it up and there's the baby inside. And so you can see, like, use resources like this. And then for older kids, you can get anatomy textbook images online. You can get you can find nice YouTube videos, but you got to be careful with those and pre-screen them. And then Google Images. I mean, everything's on Google Images. Okay, Tales from the Bus. So this is one of my favorite stories of my 12-year-old, who will remain nameless, because it really illustrates a childlike understanding of things and people misconceiving what they say. So, some background. Child on the bus says to little girl on the bus, and gets in trouble, that he's telling everybody she wants to have sex with everybody. Right? That sounds bad. Fine. Mom asks, what do you think sex means? 10-year-old, it means holding hands and getting married. Now you could see why the 10-year-old might say this little girl wants to have sex with everybody, because 10-year-old does not understand what sex means. So at this point, decided this might be a good time to explain exactly what sex is and have a conversation. And it was a great opening, but now you can see the misconception a lot of people have for what their children really know and don't know, because they're taking an adult perspective on sex and putting that onto a 10-year-old and saying, well, they must know. If they're using the word, they must know what that means. So you really want to, it's an opening for your kids, and to trust them that maybe they aren't as weird as we think they are, although they are pretty weird in other ways. And then another thing these are 2 personal things for me. When I was a teenager, my mom passed away when I was young, but one of the things she said to me that stuck in my brain was, if you think about having sex before marriage, call me and I'll talk you out of it. Now, I know in our day and age that is not common for people not to have sex before they get married, but I will tell you, this stuck with me. So I was in a lot of scenarios, and I thought, what would my mom want me to do in this situation? And I think kids really want their parents to be that leader for them. And like I said before about goals, tell them, this is what I'd like you to do in this situation. Let me be there for you, and I'm not going to yell at you, and I really want you to come to me and talk to me. All right, so a word about abstinence. Abstinence is a big word that they talk about in the media, and it's all in the schools about not handing out condoms, not teaching health, not teaching what sex means, not teaching this information to our kids. And it's a very right-wing thing, and I think it's a little misguided. I think that abstinence-only education limits what your children understand, and so it potentially they make bad decisions because they don't have information. However, that doesn't mean that you don't have to tell your children what you want for them and then encourage them and continue to help them make those good choices. So abstinence is not having sex, and it is the only reliable way to prevent pregnancy. It's the only reliable way to prevent STIs, sexually transmitted diseases. And like I said, I think teaching abstinence only hurts them in the long run. But I think you should explain why it's a good idea to do this, and then encourage them that I'm going to give you real information. I'm going to teach you about sex so that you can make good decisions later on in life. And then again, listen. And I tell and show them you love them no matter what they do. And I say that because I have had young girls come into my office who got in bad situations and they had sex, and their parents, they were so afraid of their parents, and their parents were so mad at them that they missed some important information, that maybe that wasn't her choice, and that maybe something else happened, that, you know, the mom could have been there for her, and she ultimately was, but it was, you know, this opportunity of when you get angry, and that's okay because you're disappointed in your kids, take a step back and say, okay, I love my daughter, I love my son, now let's move on and figure out how we're going to do this together. And I really encourage you to do that with your children because they want you to be there. And one thing I really have seen a big uptick of is parents coming with their children to their gynecology visits and really being an active participant in, you know, sex education. So anyway, that's that. All right, so when to start visiting the gynecologist. And this is particularly for girls, but most pediatricians can handle teenage issues up until, 18, 19, 20. So probably a good time to start to see the gynecologist if you have a child who does not have any gynecologic issues and is totally fine, and they're not yet sexually active. It's probably when they go to college. It's a good time to get initiated. They're going off on their own. Get them to a gynecologist. Get them, at least the idea in their head of what that means, and how they can obtain gynecology visits when they're in college also. But there are some reasons that you should bring your daughter sooner. So your daughter has a menstrual disorder that the pediatrician can't take care of. So they have heavy bleeding. It's not being controlled by just birth control pills, or the pediatrician feels more comfortable referring to the gynecologist for those issues. Your daughter has another gynecologic problem that might need surgery, like an ovarian cyst or something wrong with the uterus or the ovaries or the vagina, where they need to come see us for some surgical type of a treatment. Your daughter becomes sexually active because at that point they really should be getting STI screening. And your daughter wants to start some form of contraception and the pediatrician doesn't feel comfortable doing it, or they want a different form of contraception besides just oral contraceptives that maybe we only do, and we'll talk about some of those in a few minutes. And then you think she wants to go, or you want her to go. I think those are totally legitimate reasons to come and visit. And my gynecology visits in those cases are really conversations. It's to bring up all these situations. So the gynecologic visit, when a teenager comes to see me, it really depends on their age, what I do, but their history. I like to do this with their parents in the room also, because the parent, sometimes the child will sit there and say, the only reason I'm here is my mom sent me. And so you want to get a history from the mom because you want to know what she's worried about. And then I do like to kick the moms out of the room because that's important. And sometimes you'll get history when they're out of the room that you wouldn't have got otherwise. So I try to take a history with the caregiver there, or whoever's with them, and without. And I look at the sexual history, toxic habits, so alcohol, drugs, smoking, partner violence. This is a common, unfortunately, date rape and partner violence is a problem in teenagers. And I ask about that because sometimes it comes up. And then we do an exam. Usually I stick with a very external exam unless they're sexually active, then I'll do an internal exam. Or unless they have a reason we need to check something in the vagina or the uterus, we need to feel something. So the exam is usually a breast exam, and I try to teach them what their own breasts feel like, explain to them when you would want to do your breast exam, and then a pelvic exam, like I said, depends on the reason they're there, and then an STD screen if they're sexually active, and counseling. So a lot of my conversation with teenagers is counseling. It's talking to them about contraceptives, about not having sex, about STD prevention, about partner violence, going through all these things, just reinforcing what we've done in the exam. And sometimes they want their moms there and sometimes they don't. So I kind of go off the girls for their cue. So a brief comment about New York State laws, because sometimes I have parents who will call up and they're upset because I can't talk to them on the phone. So in New York State, the age of consent for sexual intercourse is 17 years old. Access to birth control and emergency contraception, pregnancy test counseling, STD screening and treatment, pregnancy care, and abortion are all available to anybody under the age of 18 that needs it. And they do not need permission from their parents. So any of these children, teenagers, can walk into my office and request to be seen, and I can see them without calling their mom or dad to get permission. I think that's a good thing, because I think what it does is it allows them to come and talk to a safe person about something scary. And I always encourage these teenagers, if they haven't talked to their parents about these things, to talk to their parents about it, because they need an advocate at home as well as at the gynecologist or the pediatrician. But I also tell them, you can call me anytime you want. And I really do tell them, if you are having sex and you want to talk to me about it and you want me to convince you not to do it, you can call me and I'll do that for you too. So I try to be as open with them as I can and give them as much access to me as possible, and my nurse, of course. But I can't talk about these issues with parents unless the child gives me permission. So that is difficult for some parents to swallow, and it comes up. We will have moms call the office or dads call the office and say, well, why did you do this? Or why did you start this birth control? And I say, well, you have to talk to your daughter. If your daughter gives me permission, then I'll talk to you. But I can't do it without their permission. So there is that. All right. And then STDs. So the big 8. I do this. I put my fingers up just like this, like they're 5. I say chlamydia, gonorrhea, syphilis, herpes, hepatitis, HIV, and I always forget, trichomonas, and HPV. That's it. I always do the fingers. I don't know why. But a lot of kids don't know what these are. They know kind of from health, but they don't really understand that if they're having sex without condoms, or even with condoms, they can get these things. And so I tell them what they are, and I explain to them that you can get these if you're not using a condom, and that's a reason every single time I encourage them, if you are having sex, you should be using condoms. I tell them boys are liars. Sorry, Mr. Magneson, but I do, because a lot of times they, are very trusting, and they don't know how to protect themselves. So if I prescribe birth control to someone, I say, you must use condoms every time you have sex. There's no ifs, ands, or buts about it. It doesn't matter. You have to stick up for yourself and say, I'm sorry, I'm going to walk out. And that's a hard thing to do. It really is. But I tell them that they should, because these are lifelong diseases. These are not just one and done. They're not chlamydia. Sometimes you come in, you get chlamydia. Is the number 1 STD in the U.S. You come in, you get chlamydia, and we can treat you. But you can also come in and have chlamydia and now have fulminant pelvic inflammatory disease, where your ovaries, your uterus, and your tubes are full of pus. And that can cause really bad scar tissue, and you can never get pregnant again. And I've seen that, and I tell them that. And that was after a 16-year-old girl, one time she had sex, and she got this awful infection. So it can cause lifelong illness. HIV is lifelong. Herpes never goes away. You need lifelong treatment. We can control some of these things, but they have lifelong implications. And I don't think teenagers think that far ahead. They look and they say, oh my goodness, this is now whatever, YOLO, and they try to move on, so I do tell them. And I do see syphilis. It's this crazy old disease, but we see it. So that's STDs. Now, Gardasil. I get a lot of questions about Gardasil. In this community, most people have their children receive the Gardasil vaccine. Now, Gardasil 9 is the current HPV vaccine that we have. And HPV is human papillomavirus. It is the virus that causes the majority of cervical and oral and penile cancers. And it is a vaccine that's been developed and is recommended in girls and boys between the ages of you can give it as early as 9, but more regularly between 11 and 12. And if you're under the age of 15, it's two vaccine doses. So they give it one at day 0, and then again in 6 months, or within that 6 to 12 months time period. And you get it. And you don't have to, if you come late, you can just get one more vaccine, and that's okay. But we try the highest benefit is if you get those 2 doses within that time frame. And if you're over 15 years old, then it's 3 doses. So it's a reason to get it in a little earlier. It covers the 9 top HPV serotypes, which are 6, 11, 16, and 18. Those account for 70% of HPV infection and cervical cancer and genital warts. And even though genital warts is not a cancer, it's annoying, and I see it a lot, and people hate it, and it's gross. So if you can prevent it, it's good. And then the other top offenders are a lot of other numbers, but there's 5 more that account for 20% of the rest of cervical cancer. So that is 90% of all HPV-related infections. And this vaccine is very effective. I recommend it. When you look, I get a lot of questions over there's terrible side effects. The side effects are not any worse than any other vaccine when they've compared it to the MMR vaccine, the measles, mumps, or rubella vaccine, or the Tdap, the pertussis, and the tetanus diphtheria vaccine. There's the same rates of issues. And so there was a big thing about multiple sclerosis. There's been anecdotal episodes, but when they've gone and there's a huge study they did in Finland, they have not shown that that's actually a valid statement that the Gardasil vaccine causes any of these issues. So it's more likely it happened and they actually also had multiple sclerosis. So that's there. But I definitely recommend it. And then contraceptives. So this is the other thing is a big discussion with my teenagers. Abstinence. I tell all my kids about that. I think they don't hear it enough from parents, and I think it's because parents are afraid to tell their kids that they don't want them to have sex. But I try to I tell them that you don't have to have sex. Condoms are easily available, and I tell them they should use them every single time, even if they're in a monogamous relationship, because boys are liars. And I didn't mean to write just contraception, but I meant to write oral birth control pills. So birth control pills, we have 9 billion different ones for any different issue. NuvaRing, which is a plastic ring that works like a tampon, you put it in the vagina, it's good for 3 weeks, you pull it out, you have your period. A lot of people like that. And then the patch, which is weekly. So these are some options that are a little less time sensitive, like they have to take it every day. And then Nexplanon, which is an injectable, it goes right in the arm. That's good for 3 years. Along with that, another similar is Depo-Provera, which is an injection that you get every 3 months. And these are some options that a lot of teenagers like because they're easier. They don't have to think so much about it. But by and large, most girls come in and they want oral contraceptive pills. And then the IUD. And it used to be that we didn't give IUDs to teenagers, but the studies have shown that it's perfectly fine. I mean, it is more invasive and it's a little more uncomfortable because they haven't had children yet most of the time, and so it's a little more painful to put it in. But they do tolerate them very well, and a lot of my college-age patients come and want IUDs. So those are there. And then that is it. Thank you so much for coming and attending our conversation, and I hope you enjoyed it.